Our coalition is happy that the governor has spoken to ending private prisons, protecting immigrant families, and continuing strides in reforming the unjust prison system to end overcrowded prisons at his inauguration. And we hope Governor Newsom will recognize that we need long-term investment in our safety net, not just one-time supplements. Our CalWORKs grants are the same as they were in 1985. There have been no real cost of living adjustments for SSI or any restoration of the SSP, which is the state's contribution to Social Security recipients, taken after the 2008 financial collapse. We had hoped for more relief for these people, but so we would like the new governor to pay more attention to the LAO than the economic studies that that the previous governor used. Moving on. What that's left us with is that existing affordable housing programs are only there for a very small portion of low-income Californians. Most low-income Californians receive little or no assistance. Even when the minimum wage reaches $15 an hour by 2022, renters will still be housing cost burdened, as everybody here knows. People unable to work who are living with disabilities receive a maximum grant of $931.72 to pay for housing, food, and all other expenses. We also hope that Governor Newsom will listen to the 20% of Californians living under the federal poverty line, and the 20% more who live near poverty. To the United States Census means what this means with the United States Census is that people are struggling to pay for food and shelter. In the richest state and the richest nation in the world, no one should be going hungry. For just a little bit of perspective, California, with our Democratic supermajority, in California, we have $201.4 billion budget, serving a population of 39.54 million people. That translates to $5,094 per capita for California. Just to compare it, the state of Texas, with a Republican-dominated state house, has $209 billion budget for a population of 28.3 million people. That is 7,385 per Texan. So we know California can do better. Our diverse coalition of service providers, union, nonprofits, and community-based organizations are coming together in unity and solidarity, calling for greater investment in California's health and human services to strengthen the safety net for vulnerable communities. It's time for California to protect all immigrants by keeping their families together safe and healthy, end wasteful spending on corrections and overcrowded prisons, build affordable bridge and emergency housing, and repair the social safety net with long-term investments in Medi-Cal, CalWORKs, CalFresh, in-home health, IHSS, child care, and return the SSP, SSI supplemental, the state supplemental to SSI. Thank you so much. And I'd like to introduce Jeremy Bruce from Siren, who will continue.
Thank you, Catherine. Voy a hablar en inglés y después español.
Thank you.
Good afternoon. My name is Jeremy Barus, and I am the Director of Civic Engagement for Services, Immigrant Rights and Education Network, also known as Siren. I am here today to speak on behalf of the immigrant families whom we work with. Governor Newsom's commitment to extend health care access for undocumented young adults in his budget message this morning is a historic step that reaffirms the principle that no one should suffer or die from a treatable condition, no matter what their immigration status is, what they look like, how old they are, or where they are born. At Siren, I work with dozens of undocumented families who truly feel the impact of not having health coverage or preventive care because of their status. Many times, undocumented community members are limited to simple home remedies when dealing with a critical health issue, or simply taking Advil to relieve any physical pain they are suffering because they don't have coverage to see a doctor. I have consoled crying teens in our youth meetings because they have watched helplessly as their immigrant parents suffer from a health condition and just try to deal with physical pain because they don't have coverage or the money to seek medical treatment for their condition. Undocumented adults are the single largest group of Californians who remain uninsured and face unjust exclusion based on their immigration status that leads to wider health disparities, and they deserve to be included in the system. The number of remaining undocumented individuals without health coverage remains at 1.48 million, and this population remains the single greatest group of uninsured Californians at 40%. Providing preventative and life-saving medical care is essential to ensuring that every Californian is able to contribute to their community, thrive in our economy, and age with dignity. Ensuring quality health care for every Californian, including undocumented adults whom the federal government continues to unjustly shut out of care, is an urgent matter and essential to the goal of health justice for all. So today, we applaud Governor Newsom for taking this first step and also call on the governor and our state legislature to pass a true health for all bill that would cover all Californians, regardless of their status. Let's show the rest of the country that the state of California continues to lead the way. The governor has taken a bold first step, but more urgency is needed in order for our families to truly thrive in our state. Buenas tardes, mi nombre es Jeremy Barús y soy el director de participación cívica de Siren. Hoy estoy aquí para hablar en nombre de las familias inmigrantes con las que trabajamos. El compromiso del gobernador Newsom de ampliar el acceso y la atención médica para adultos jóvenes indocumentados en su mensaje presupuestario es un paso histórico que reafirma el principio de que nadie debe sufrir o morir por una condición médica, sin importar cuál sea su estado migratorio, su aspecto, su antigüedad, ellos son o donde nacen. En Siren trabajo con docenas de familias indocumentadas que realmente sienten el impacto de no tener cobertura médica o atención preventiva debido a su estado. Muchas veces los miembros de la comunidad inmigrante se limitan a remedios caseros simples cuando se enfrentan a un problema de salud crítico o simplemente toman un Advil para aliviar cualquier dolor físico que estén sufriendo porque no tienen cobertura para ver a un médico. He consolado a los jóvenes que lloren en las juntas de jóvenes porque han visto sin poder hacer nada que sus padres inmigrantes sufren una condición médica y solo tratan de lidiar con el dolor físico porque no tienen cobertura o el dinero para buscar tratamiento médico para su condición. Los adultos indocumentados son el grupo más grande de californianos que permanecen sin seguro, se enfrentan a una inclusión injusta basada en el estado migratorio, que conduce a disparidades de salud más amplias y merecen ser incluidos en el sistema. El número de personas indocumentadas restantes sin cobertura de salud en California es de 1.48 millones de personas y esta población sigue siendo el mayor grupo de californianos sin seguro, 40%. Proporcionar atención médica preventiva y para salvar vidas es esencial para asegurar que cada californiano puede contribuir a su comunidad, prosperar en nuestra economía y vivir con dignidad. Asegurar una atención médica de calidad para todos los californianos, incluidos los adultos indocumentados a quienes el gobierno federal continúa excluyendo injustamente la atención médica, es un asunto urgente y esencial para alcanzar la meta de justicia de salud para todos. Así que hoy aplaudimos al gobernador Newsom para dar este primer paso y también pedimos al gobernador y nuestra legislatura que aprueben un verdadero proyecto de ley de salud para todos, que abarque a todos los californianos. Mostrémosle al resto del país que el estado de California continúa liderando el camino. El gobernador ha dado un primer paso audaz, pero se necesita más urgencia para que nuestras familias realmente prosperen en nuestro estado. Gracias.
Thank you. Right now, we're in California, we're in a housing, a human needs, and a poverty emergency. 1/3 of renters in the state of California pay over half their income in rent. An emergency situation requires an emergency response. Not only money, but also we need a whole new paradigm for using the money that we do spend. And believe me, the money's available. We live in the richest state in the country, and we live in the richest area of the state with the wealthiest corporations all around us right here in Silicon Valley. California's and America's housing system is fundamentally broken, and it's getting worse, not better. Homelessness and homeless deaths are increasing. They're not going down. The San Jose Housing Department came up with this chart a couple of months ago that shows there, with all the efforts in the city of San Jose and the county, we're housing about 100 people a month. But for every 100 people that we house, 300 new people are becoming homeless every single month. This is not working. I appreciate and we all appreciate the local and the state voters for supporting affordable housing, all the bonds and all the efforts of people like Senator Bell and Assemblymember Kalra for legislation to attempt to fix the housing situation, but we actually need a new approach. We need massive state and local investment in what's called social housing or public housing. In San Jose, private developers have actually come down to city council and said they are going to refuse to build more housing in San Jose until the rents go up another 20 to 25%. And they're already $2,000, $3,000, or $4,000 a month. This is not a sustainable situation. We need to organize a housing system which is based on meeting human needs and not on the basis of private profit. No person, and this is actually the federal standard, no person should pay more than 30% of their rent, of their income, for rent. That's just a humane standard which has been adopted by the federal government for over a century. And unfortunately, even all our affordable housing programs that we have locally, they use a different standard for rent. They base their rent on a percentage of annual median income. And as a result, a lot of our poorest people are frequently getting rent increases of 10% or more sometimes because the annual median income in Silicon Valley rises so quickly that the rents go up accordingly. This is not a sustainable situation. We also need state programs and housing that offer real solutions, like statewide just cause and rent control. We fixed at no more than the CPI, the Consumer Price Index. We need a surplus land act with teeth to prevent sales of valuable public assets like the land which San Jose just sold to Google for private profit. We need a state fiscal reform to incentivize housing instead of commercial development, and we need to encourage community land trusts and programs like the small site program they have in San Francisco, and what's called the Tenant Opportunity to Purchase Act, which they have in Washington, D.C., which any time a building their ownership is being transferred or is at risk of demolition, the tenants have to have an opportunity to purchase it before they can be sold to others. So we need innovative programs, we need a new paradigm, and we do of course need resources. Thank you.
All right, thank you. Good morning or afternoon, rather. My name is Christine Fitzgerald. I'm from the Silicon Valley Independent Living Center. What's been said here is very profound, and it's very true. So many people are living below poverty, way below poverty. How somebody receiving $930 a month is to be able to afford even 1 month's worth of rent for a $3,000 rent here in San Jose, it's impossible. You're not even talking about food or clothing or medication that they may need. The challenge of what we faced has to be faced boldly, and it has to be faced now. Having the new governor taking the oath and presenting his budget for the coming year is fantastic. It's a new start. It's a new beginning. We do need to have a new paradigm where people are thought of, where thoughts are created to encompass the whole person, not just the dollar, not just the corporation. We live in one of the richest areas of the state. The biggest challenge, of course, is the housing, is the medical coverage for all, medical coverage for all. That's why it's so important to work towards a universal health coverage here in the state of California and beyond. I look forward to working with my fellows around me and the state legislator and Governor Newsom to find new and innovative ways of creating affordable, accessible housing, creating new ways of thinking about jobs for people with disabilities. We're thinking about new and innovative ways of working and living and growing together as a unit, whether or not we have disabilities. Thank you.
Great.
I am Bill Wallace. I am representing the California Alliance for Retired Americans. And there's a lot of things that the Alliance works on. But one of the important things that we're concerned about are issues concerning seniors. Affordable housing is one of them. And IHSS is one, in-house service for people that are unable to take care of themselves. And supplemental income, SSI. And as you think about it, as we speak here, as we're standing here, there are a lot of people here in the state that are probably fighting to stop any additional help for people that are needy. And what we're doing is asking Governor Newsom to take the leadership and make sure that in his budget, he's addressing the people that need his leadership, and we need the leadership of the legislator in order to do this. And so that's what we're here for today, is to talk directly to our government, to our representatives, to let them know that there is a tremendous need out there. And Kara will work side by side with the legislators and with the people that behind me to make sure that this is taking place. And we need to work with everybody in the community, for example, with healthcare issues. There's a tremendous need for healthcare issues, healthcare, and without, a concerted effort to create a healthcare that takes care of all of our needs. And the only way that we can do that is to be inclusive and include everybody in the discussion, so that we do not just get a healthcare that says take it or leave it. We have to have a healthcare system here in California that supports everybody. And this is what we are here for, to make sure that this does happen, that the governor includes this information in his budget and looks at the budget excess and do something with it, rather than just give it away to people that don't really need it. And the people behind me represent the strength behind the efforts to improve the lot of those who are less fortunate. And we need to continue to work on this, each and every one of us. And I think that this is something that I think we can work on. I kind of look at it in a positive way. And hopefully we have a very much better 2019. Thank you very much.
Hi. I am going to talk about what she said, and I can talk about it both as a person who is trying to obtain in-home support services for my mother. I'm also here to talk about my experience of being needing extensive healthcare services and not being able to get them. First, let's start out by saying what they're doing is inhumane. People are in much more need than what they are getting. First off, it's really hard to get on Medi-Cal, which is what you have to do to get any kind of in-home health support services, unless you are rich enough to pay to have somebody come in and help you run it. There are fewer and fewer and fewer of those who can do that. Like I said, it's hard on both patients and on the workers. Patients, such as my mother, had to apply for Medi-Cal. She was a healthcare worker, in-home support worker herself. Now that she needs it, she cannot afford it. The only way that she is able to get in-home support services was to get on Medi-Cal. Well, you know what? Those people who are on Medi-Cal either have to pay a large amount of their share of costs. Medi-Cal only considers $600 for the rent. That's all they allow. When I was applying for my mother on Medi-Cal, you went around and around and around and around in services. Each time you went, there was somebody else who told you you needed another form or that you weren't doing it right. Once I was able to get her in-home health support services, I found out that, number one, they don't give you enough hours of a person who really, really needs in-home support services. All they give them, they'll come out with a social worker, and they will allot so much time for each individual service. They need to have more hours expanded so that patients can get the care that they really need. I also want to talk about the IHS workers. The IHS workers only make $13 an hour. How many of us can survive on $13 an hour? None of us. I can't, and I don't think many people can. And that's how they end up having to work really hard and maybe take on several other jobs to be able to survive. The other thing is that when one of my mother's IHS workers, because her apartment was no longer affordable, she couldn't find a place to live. She had to move, and the only place she could find was with her father. So now she has to travel quite a bit farther away to come to go to work. As far as myself, I had surgery. I had to end up in rehab, which is another word for what used to be called convalescent hospitals. I myself worked in that field when I was younger. The staffing was horrendous. There were 4 floors, and when you worked overnight, the nurse had to rotate between all 4 floors. I had, when I worked the night shift, 22 patients by myself. I had to get a certain number of people up and ready for breakfast. Some of them were wheelchair bound. I had to help them out of bed, get them into the wheelchair, and then get them dressed.
And
This is ludicrous.
what you saw at the rehab place was.
And then when I was in rehab myself, first let me tell you, our Medicare system will only allow 3 months for Medicare. Anything after that, you're booted out. When I was in rehab myself, there were workers there who made more than $13 an hour, but they had to work 2 jobs. They would get off one place and have to go to another place to work another 8-hour shift. So basically, these people were working 16 hours a day just to be able to survive. Workers, when I was there, got sick because they were so overworked that they had to call an ambulance for him because he was so sick and he collapsed. They say that they have upgraded, that the standards are much better as far as the ratio of patient and provider care, the CNAs. That's not true. When I worked there myself many, many years ago, you still, basically, the numbers that they had when I worked there was basically the same patient ratio. I was told, oh, standards are much better now. It's not as bad as it was when I worked there. It's not the same. It is the same. It's not any different. It was frustrating. I didn't have to wait. Once when I had my inhaler missing, I was having an asthma attack. I called for the nurse. It took me 20 minutes for the nurse to be able to finish and come and give me my inhaler. That should not happen. If there were more nurses and more providers that could be able to do that, that wouldn't have happened. And also what they did is every week they had a
Care conference.
a conference with the charge nurse, a physical therapist, an occupational therapist, the so-called social services person, who I found out there is not one MSW in that department. They were people that just were the ones that decided, along with, for me, a nurse from where I get my health care. Every week, I had to have somebody with me to help me fight to stay in there until I was strong enough to be able to be safe to come home. That is horrible, absolutely horrible. That shouldn't have happened. And after that, like I said, Medicare will only cover 3 months. We need to look more at also long-term health care.
Yes.
After we retire. I had no idea that there was not any coverage. You had to buy it for long-term care coverage. That meant after Medicare ran out. They're telling me, when I went online to do some research, that if I went on trying to get long-term health care fare, I was unable to, because I was 60 and old. They said if you're starting at 60, it's not going to be enough. If you start when you're 20 or 25, then you could pay into that insurance and get it. They're just ludicrous that people are not able to get the health care they need, get their needs met, and we have to pick and pull to try to get any services that we have. Thank you.
Thank you.
Hi, my name is Joan Simon. I am a member of the Santa Clara County Single Payer Healthcare Coalition. Every year, the cost of healthcare goes up, as does the profits of insurance companies. And at the same time, millions of Americans don't have health insurance, and millions more have inadequate health insurance. The foundation of our healthcare system is immoral. It is a system based upon profit, not caring and compassion. Access to our healthcare system is all about affordability, not human need. So here we are, once again at the beginning of another state budget process. Our new governor, Gavin Newsom, has submitted a budget proposal to expand Medi-Cal eligibility to undocumented young adults aged 19 to 26. We applaud this proposed expansion. However, if passed, it would still leave undocumented adults aged 26 and older unable to access government health programs. We believe that it is our moral obligation to provide all residents, including undocumented adults, with health care. We believe that health care is a human right. We need an improved Medicare for all system. An improved Medicare for all system would provide every resident with good quality health care, dental care, vision care, mental health care, and long-term care, regardless of ability to pay, health status, or immigration status. An improved Medicare for all system would cost less than our current healthcare system, because it reduces the profit motive and waste in our current system. We will have an improved Medicare for All national bill and also a state bill coming out in a few weeks. We are also working to expand our healthcare movement. Won't you join us in our fight? Thank you.
All right. Actually, we're a statewide chapter of 9 to 5 now, National Association of Working Women, which has been in existence since 1973. And the movie was inspired by the organization, not vice versa. So what I wanted to talk about is the fact that in this budget, their governor is still making sure that we have funding because there will be a financial crisis. And that's important. But the problem is that families, low-income families or just plain poor families without much income, need to have better state help as we did in the past. The level now, as Catherine said, is about the level of 1985. And there have been slight up and downs because of the budget crises. We need to use some of the money that we have here in California to get back to a reasonable level of help for people who really need it. And so that is one of the things, one of our 9 to 5 is the National Association of Working Women, as I said, but practically every woman works if possible, whether for pay or otherwise. So a lot of our members and organizing is done around the people who are on what's called welfare, or what used to be called welfare. So we hope that the state legislature will add to the governor's budget. The governor's budget is a proposed budget. It's not the only thing that there can be. And we hope that that our state legislators and others will help to increase the payments to people who really, really need help. Thank you.
Right.
Joan?